I would just ask your consent to gently and delicately touch your ears. Do you feel any pain or discomfort so far? I am just slightly pulling your ear now, having a look at your ear canal.
So I just want to take a quick peek inside each one of your ears. Okay, you can hear the popping.
Hi, welcome. You're here for your ear exam? Yes. So I will firstly determine what is the issue with your ears, and then we will have our very professional nurse Adonria taking care of your ears. I'm sure that she will for sure perform an ear cleaning for you that will be absolutely suitable for the kind of issue that you have and that we will figure out together now, okay? Alright, so let me pop on my gloves real quick as I want to ask you a little more information about what is going on and what brought you here. What is the kind of discomfort that you feel on a daily basis? So you feel some like whistling, okay? And do you fear that this affects your hearing capability, or is it just uncomfortable? Do you experience any itchiness or maybe a little bit of pain or something? Okay. So the first thing that I would like to do is to proceed with a sensory test. So I will touch your ears and just see if there is anything that is abnormal just at the touch. Okay, and of course in this phase, if you experience any kind of pain and discomfort, it is absolutely important that you let me know, okay? After that, I will have a little bit of a deeper look inside your ear canal and perform some hearing tests on you to determine how affected your hearing is. And then overall we will have a look and just determine what Nurse Adornia will have to do next and which specific ear cleaning treatment is more suitable for your issue. Okay, good. So if you don't mind, I would just ask your consent to gently and delicately touch your ears. Of course, my hands are sanitized and the gloves are disposable and absolutely clean, okay? Can I please touch your ears? Thank you. So, at a first touch, I am just checking to see if there is any asymmetry or anything abnormal about the two ears, okay? And see Do you feel any pain or discomfort so far? Alright. Okay. So now I am just really close to this part here of the ear, the cartilage part of the ear, okay? How is it feeling? Okay, I'm just moving downward. Okay. And now we are up to the lobe. Good. Did you feel anything particularly remarkable so far? Okay, the good thing is that the asymmetry is perfect and that there is no particular masses or irregularity or tenderness at a first experience, at a first touch, okay? I now want to have a look at the single ears, okay? So we'll go a little bit deeper, okay? So I'm just starting with your right ear. Yeah, we have a little bit of a problem sometimes with left and right. How is it feeling so far? Okay. I'm just squeezing and folding, just seeing how your ears react. Okay. Everything looks good here. I'm moving to the other ear now, okay? How does it feel? Alright. Okay. So the good thing is that as I initially thought, there is nothing worrying into the outer ear, okay? I now want to go for a little more specific and in-depth examination with my light to dive a little bit deeper into your ear canal, okay? Alright, allow me to. So, as I promised, I will be extremely gentle, okay? And if you feel any pain or discomfort, you just let me know, okay? I am just slightly pulling your ear now to have a look a little bit deeper into the canal. Good. Alright, so there is a little bit of redness just here. Yeah. Okay. So yes, I see what is causing you that discomfort. It's just a little bit of a infection, I would say. Did you expose yourself to major temperature changes or very windy situations? Did you sweat a lot? Okay, I see. Alright, so there is a little bit of ear infection into your right ear. I will have a look at the left ear as well to see if there is the same problem, okay? So I am just very gently having a look at your ear canal. Okay, again, here I am slightly pulling your ear up. Let me see a little bit deeper into your ear canal. Yes. And again, here I can see that same infection. Yeah. Are you allergic to any foods or products? That might also be a cause. Okay. So, if you can recall a little bit of your most recent life changes, that would be really helpful. Okay, yes. So you've been sweating a little bit and just going to the seaside, walking around. I see. Well, that's totally normal. There is this change of temperatures right now, and it's okay to actually experience this kind of infections because our body is still not used to that. The water is still a little bit warm, a little bit cold, and that's how the ears can actually get infected. Okay, now that we have seen what is happening inside of your ears, I just want to perform a couple hearing tests on you, okay? Just to know how bad or how not at all affected your hearing is, okay? I will first just wiggle my fingers and I need you to tell me if you hear it to the left or to the right. Sometimes it can even be both, okay? Good. Let me change a little bit. Yeah. Good. Okay. Good. All right. Now I will be still wiggling my fingers and you tell me when the sound disappears, okay? Good. 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 Okay, very well. Now instead, I will just whisper some words into your ears, okay? I need you to tell me to repeat these words, okay? The thing is, they will not only be in English, okay? I will use some words in other languages just to test how your ears can reproduce a sound when there is no brain intervention into correcting if you have some lack of hearing. Let's get started. Rainbow. Grass. Soda. Gazelle. Yes. Now let's start introducing a little more, okay? Different languages. Maison. Yeah. Fenster. Calle. Coltello. Estrella. Quebramola. Ratatouille. Yeah. Brillen. Okay. Cachorro. Okay, good. Your hearing is reproducing the sounds really, really well, okay? Now I just want to place some ear headphones on you with really fluffy sound cancelling effect. So, can you hear me? So, you can only hear my voice now, and I will just play some beep sounds, and I need you to raise your hand whenever you hear the beep, and if you can possibly tell me if you hear it to the left or to the right, okay? Mm-hmm. 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 Very well. The beep test went well, so your hearing is luckily not affected by the infection, but I will just address you to Nurse Adonria right now that will perform an ear cleaning. Also, if you want to head over Adonria's channel, first of all, I will recommend you to subscribe to both of our channels, and you can see us switching roles. So I will perform the ear cleaning while she will be performing the ear exam, and she's an absolute pro at doing this kind of role plays. Thank you. Bye.
Hi there. I'm the nurse that's going to be taking care of your ear cleaning today. It's very nice to meet you. Hopefully we can get you feeling better, okay? Okay. I'm just going to read over the doctor's notes real quickly, okay? I just want to make sure I'm up to speed on what we're taking care of, okay? Okay, it's looking good. Before I proceed, I would like to take another quick look inside your ears. Sometimes it's hard to write down in the paperwork exactly what's going on. So I just want to take a quick peek inside inside each one of your ears, and then I'll have a better idea of what I should do, okay? Is that alright with you? Okay, perfect. I'm just going to get a little bit close to you, okay? Okay, so I definitely have a good idea of what we need to be doing. So we're just gonna get those ears nice and clean, okay? So I'm fairly gentle. Have you ever had your ears cleaned before? Okay, first time. Okay, don't worry, I've done many ear cleanings, so I definitely know what I'm doing. I'm gonna take really good care of you, okay? So first of all, I'm just going to put some earwax dissolver into each one of your ears, okay? It's going to be quite poppy, okay? Don't be alarmed, that's how it works. It's nothing wrong, okay? But if you do experience discomfort with that, let me know, okay? Okay, I'm going to put it into your first ear here. about now? How's it doing? Subside a little bit. Okay. Let me just get some cotton rounds and kind of clean up the discharge that's running down your neck here. Okay, I'm going to clean up the other side now, okay? Okay. That felt pretty awesome, right? I always think that's the best part. Okay, so now I'm just going to take this nice gentle ear pick. I'm going to try to be a little bit more gentle today since you've never had an ear cleaning before. And we're just going to gently remove any of the earwax debris that we find in the ear, okay? Does that sound okay? Okay. Does that feel okay? Okay, good. Oh yeah, this is coming out really, really nicely. Really, really nicely. Let me know if it's ever too uncomfortable for you, okay? Okay, perfect. Okay, I'm going to do the other side now, okay? You still holding up okay for me? Okay, great. Is that side feeling okay? Okay. I'm going to do both others at the same time this time. Is that feeling okay? Okay, good. Is it all holding up okay? Okay. Alright. Now I'm just going to take some Q-tips and gently clean out the outside of the ear, okay? This part shouldn't be discomfortable at all. Might be a little bit ticklish, maybe. You're doing really well though, especially for your first time. Okay, I'm really freaked out by this. So you're doing great. Okay. Okay, well, you are all taken care of for today. Thank you so much for letting me work on you. Hopefully it wasn't too scary for you. You did a really good job though, so. But you're all set, and if you just want to go up to the front office, they'll be able to help you with any follow-up appointments, any antibiotics that were prescribed to you today. or anything like that, okay? Okay. Did you have any questions for me or the doctor this time? No? Okay, great. It looks like we'll see you. I think she made a note here. Looks like maybe 2 to 4 weeks. We'll see you in, have you in again for a follow-up appointment. Okay. Alright, well, thank you for letting me work on you today. You have a wonderful rest of your day, okay? Okay.